Hello everyone. Welcome to FitTalk. I am Dr. Dikshit Kumar Thakur, a practicing pulmonary and critical care consultant currently working at Artemis Light Hospital, New Friends Colony, New Delhi. Today we are going to discuss about the asthma patients and what all precautions they have to take during this season change. So basically during this season change, any asthmatic patient and most of them I would say suffer from many of the increased symptomatic changes like extreme weathers like changing towards too much of cold, too much of humidity, and during these weather changes the air quality also changes. All those changes can trigger the symptoms of asthma patient. So in asthma, basically the disease is the inflammation of your airways, in which your airways gets inflamed because of any of these triggers, and it becomes narrow and your breathing becomes difficult. More cold exposure can trigger the asthma in some of the patients. Too much of humidity can trigger the asthma symptoms. Many patients can have increased breathlessness, they can start having coughing, they can start feeling these chest tightness. So asthma patient, it's not a common allergen which can trigger a symptom in every one of them. So basically there are a lot of triggers and everybody will be having different. Still, to enumerate a few, the most common are pollens. Now, as we know that this is a spring season and too much of pollen production is there around the corner. So then many patients are allergic to these spring season pollens. Many are allergic to the when the rainfall is increased during the July, August, that time when some pollens are coming. So different people have allergy to different pollens. Pollen is one of the most common allergen. But to have the other names like mold like fungus which grows in the damp areas, that is another allergen which patient of asthma can have increased symptoms. Another are like dust mites, pet dander, and even the severe air pollution which we face in metros during the winter season of the year, that also can trigger the asthma symptom. So the treatment for asthma, the ideal gold standard treatment I would say is the inhalers. So basically the inhalers directly delivers the drug into the airways where there is inflammation, and we get the best results with that. So inhalers the asthma patients are regularly taking, and that keeps their symptoms under control. But during these season changes, they might require the dosage changes of their inhalers. They might require the increased dosage, which was less when they were having the comfortable time. So regularly they should take their inhalers, and if their symptoms increase, they should meet their doctor. Basically, their doctor can help them to titrate the therapy according to their needs so that they can remain symptom free and can live their normal life. Doctor can help you to find the allergens also which you can avoid and can have a better lifestyle just because you avoided that allergen and you don't get the symptoms. The first suggestion is avoidance of allergen. Easiest said than done, but if you know that this is an allergen which causes you trouble, like there are some pollens, you know that in April I got this pollen allergy and I got the increased symptoms. So you should avoid going out and doing workout in the outdoors during that time. You can use air purifiers, you can close the windows of your room and keep an air conditioner on so that you get a filtered air and you can avoid the exposure to that. If you know that house dust mite is a allergen for you, you can keep your house clean, do regular vacuum cleaning. You should not have damp carpets. So you can avoid the allergen and you can get a symptom free period. Along with that, I would suggest that vaccination is another important factor which should be taken into consideration. Now, as the influenza season is coming, you can have an influenza shot, which will prevent you from getting a serious disease, and in many cases, you won't even get the disease. And COVID vaccination booster, if you haven't taken, you should take that. Peak flow meter is a really good device. It is just a device in which patient inhales deeply and then forcefully exhales, and there comes a value. So during the normal times when the patient is symptom free, so he checks this value and it is more or less stable. So this is his baseline value. And asthma control and the management of asthma, this peak flow meter is very important. So how these asthma patients keep a daily log of their peak flow meter, that this much is, let's say, a 450 ml is my value. When there is a asthma attack, this value starts falling. So once this value starts falling, it falls generally before you start getting the symptoms. So patient can know that my overall control of asthma is going down, and he can increase his therapy or he can talk to his doctor and he can titrate his therapy so that they can detect the symptoms early and they can treat it early so that patient can live quite a normal life and without any symptoms. Best possible way is to control your asthma symptoms. First, take your medications regularly. If your doctor has suggested that you have to take your inhaler twice daily, so don't try to skip any dose. One, if you know your allergens, you should avoid that. The ideal therapy is preventive therapy. So if you won't get the exposure, you won't get the symptoms and you will be good. And another important factor I would like to emphasize is vaccination. Flu vaccination is quite an important factor which should be taken into consideration. And if you are taking it regularly, you might get less symptoms and less flu compared to a person who is not taking the flu shots. Thank you.